Hey everyone, my name is Raquel. I'm with Body Interact Virtual Patients. We provide a very hands-on and realistic experience for students, and our virtual patients react just like real humans. So you can talk to them, you can examine them, they have a problem, and you have to use your brain to make decisions and think critically in real time and try to save the patient. But I think it will be best if you join me here while we see what's up. So we have a very realistic 3D patient. We can ask some questions to see how he's doing. How are you feeling?
I'm not quite sure what you're
The
asking.
patient seems to be a bit confused. We can ask if he has any health
I'm
issues,
feeling a bit confused. I believe I might have
might have
diabetes.
diabetes. So we are in a virtual emergency room. We have many options available to us. If we want to do, for example, quick physical examination, we can observe the airway. This one is clear and looks good. We can also do some auscultation, and we can hear realistic sounds. But there's also much more available. We can monitor the patient in real time. Okay, this is the blood sugar level. This is already a concern, so it's pretty low. We might need to do something to address this patient. There are also a great variety of tests available. Some tests, for example, some imaging tests. Of course, this is not a priority. I'm just showing you the options. But everything will be very visual and very interactive, as you can see. Let's order probably a biochemistry. So the exams arrive. They may look good or not. It's up to us to decide what the patient is needing. And um, let's wait a little bit more. In the meantime, you can also call for help if the patient needs to be sent to a different hospital. And you have a bunch of interventions as well. So some scenarios are more basic, so you just need to talk to the patient and do a physical exam. Others, you can really try to achieve a diagnosis and actually apply a treatment plan to the patient. So right now we have a confirmation that indeed the glucose is pretty low. So I think the best thing to do here would be to give a little bit of glucose. The fastest way would be IV. So I'm right now inserting a catheter. But we like to do something as well. So instead of following the good pathway, I would like to play the role of a distracted student, and mistakes can happen in real life. And Body Interact allows for that kind of mistakes to happen. So if instead of sugar, I decide to give a bit of insulin to this patient, and insulin will make the sugar go even lower, we'll be able to see in real time the effect of my wrong decision on a patient. So right now I'm giving 6 units of insulin, which is totally wrong to do in the real life. But this is a safe learning environment, so it's really okay for these mistakes to happen. As you can see from a simple problem, we now have a patient that completely. Sorry, I'm missing a word. You may get this part maybe. So the patient is not okay anymore. From my decision of giving insulin, I turn on a completely different problem. So now I would need to revert the situation. This was just an example for you to see how realistic it can get. And at the end, you have a very thorough debriefing area where you can get some more feedback, all the actions that we did correctly, incorrectly. So everything is explained here. Our product is catered to a wide variety of educational programs. So we have medical programs, DO and PA. We have nursing programs, scenarios specifically for LVN, RN, APRN. And we also target EMS, so not in hospital scenarios and pre-hospital environments. And also high school and CT programs with very basic but very educational scenarios as well. So if you want to hear a little bit more, or if you want to experience it for yourself, we would be happy to connect with you. Thank you, and see you next time.